Recent study conducted by All India Institute of Medical Sciences and published in the top medical journal The Lancet showed that only a small proportion of patients, say around 10%, with cardiac and stroke emergencies reach health facilities within an hour, which is critical in preventing death. In this slideshow, we will look at the causes and risk factors for arrhythmia and atrial fibrillation, which is a major cause of stroke. Symptoms include fatigue, trouble breathing, and dizziness. Also, please check out some of the tips for lowering your risk and managing the risk factors at your home to prevent the risk of developing atrial fibrillation. Arrhythmia. Arrhythmia indicates a problem with your heart rate. When your heart's beating rhythm is off, that's called an arrhythmia. There are many ways for your heartbeat to be irregular. Some of these irregular heartbeats, called arrhythmias, don't cause symptoms. It is important to see your healthcare provider if you do notice symptoms like extreme fatigue or heart palpitations. Your provider will help determine the best treatment option for you. But you can also help yourself by making appropriate lifestyle changes. An arrhythmia is a heart rhythm that is normal. Your heart may be beating too fast when you are at rest or just not beating in a regular pattern. Arrhythmias range from harmless to serious, with symptoms, without symptoms. There are many options to treat arrhythmias, but some arrhythmias don't need them. The prognosis varies greatly depending on the type. There are four major types. Tachycardia, when your heart beats too fast, usually more than 100 beats a minute. Bradycardia, when your heart beats too slowly, below 60 beats a minute. It's normal for athletes. Supraventricular arrhythmia, an arrhythmia that starts in your heart's upper chambers. Ventricular arrhythmia, an arrhythmia that starts in your heart's lower chamber. Causes of arrhythmia. Several things can lead to arrhythmia. These include clogged or hardened arteries, high blood pressure, or issues with your heart's valves. It also can be the result of trauma from a heart attack. It can happen as you recover from heart surgery and if your electrolytes are out of balance. Say, for example, if your body has too much or too little potassium. Atrial fibrillation. Atrial fibrillation is the most common type of arrhythmia. It causes a fast and erratic heartbeat. There may not be any symptoms, or you may notice chest pains, palpitations, or shortness of breath. Atrial fibrillation can interfere with the blood flow to your lower heart chambers and can cause clots or a stroke. What is AFib? Atrial fibrillation is a condition that disrupts your heartbeat. A glitch in the heart's electrical system makes its upper chambers, the atria, beat so fast they quiver or fibrillate. This causes the lower chambers, the ventricles, to beat out of sync. AFib can be dangerous because it raises your risk of stroke and heart failure. Not a normal heart rhythm or heart rate. You can check out this small video that is attached. Usually the atria and the ventricles work together, so the heart pumps blood in steady rhythm, but in AFib they don't. The irregular beats can cause a fast fluttering heart rate, about 100 to 175 beats a minute, instead of the normal 60 to 100 beats a minute. Let us now understand AFib symptoms and risk factors. When you're first diagnosed with atrial fibrillation, it's important to learn as much as you can about your diagnosis. Understanding what may have contributed to your AFib can help you control it. Some risk factors for AFib include high blood pressure, history of heart disease or heart attack, diabetes, sleep apnea, history of heart surgery, excessive alcohol use, and smoking. Know your risks. When you have an episode of AFib, it can feel odd, but you can live for years with AFib without any problems. The real risk of AFib is that it increases your risk of having a stroke or developing other medical problems such as heart failure, chronic fatigue, other heart rhythm problems, inconsistent blood supply. Should know the warning signs of a stroke. For many people, AFib symptoms are not obvious, but when they will often include an uneven pulse, a racing or pounding heart, a feeling that your heart is fluttering, chest pain, feeling short of breath, lightheaded, or dizziness. Other signs of a stroke can include sudden numbness of your face or extremities, sudden confusion, sudden trouble walking, sudden severe headache. When it's an emergency, since AFib increases your risk of having a stroke, you need to know the warning signs. You can remember the acronym FAST. F means face drooping, A for arm weakness, S for speech difficult, T for time to call an ambulance. AFib isn't always a cause for alarm, but you should call emergency if you have chest pain, uneven pulse, and feel faint, signs of a stroke, such as numbness or slurred speech, and let your doctor know whenever something doesn't feel right. Causes of AFib. What causes it? The most common cause that strain your heart include high blood pressure, coronary artery disease, and heart attacks. Heart failure, problems with heart valves. Sometimes AFib may be set off by thyroid disorders or serious infections like pneumonia. Avoid the triggers. You may find that certain things trigger your AFib. If possible, you should avoid these triggers. Learn to take your pulse so you can see if it's fast or irregular. Some common triggers for AFib include tiredness, alcohol, stress, caffeine, anxiety, smoking, illness, and maybe some medications too. Diagnosed with ECG. Diagnosed with ECG. The way to confirm AFib is with an electrocardiogram, EKG. The machine detects and records the electrical activity of your heart. So your doctor can see problems with its rhythm. You can do it in the doctor's office, or you may need to wear a device that keeps track of your heart's activity for a longer time to catch an episode. The device can be worn from 24 hours to 2 weeks and sometimes longer. Other tests. If an EKG shows AFib, your doctor may want to learn more about your heart. An echocardiogram or ultrasound can show valve damage or signs of heart failure. A stress test can reveal how well your heart does when it is working hard. Your doctor may also want tests to look for conditions that could have triggered your AFib. Prevention. Eat a healthy diet. A heart healthy diet is the best one to follow when you have been diagnosed with AFib. Eat minimally processed foods, including lots of fruits and vegetables. The same healthy habits that protect you against heart disease will protect you against AFib. Eat a nutritious diet that includes fish, exercise regularly, control your blood pressure, don't smoke and avoid secondhand smoke, decrease or avoid alcohol, reduce your stress. Reduce your stress. Stress and mental disorders may make your AFib symptoms worse. Finding healthy ways to manage your stress can improve your symptoms and your quality of life. Some methods for managing stress are meditation, relaxation, yoga, exercise, a positive outlook, a healthy diet, and supportive friends. Exercise. You may be worried that exercise will make your AFib worse, but regular exercise is important. Exercise can help to reduce your AFib symptoms, lower your resting heart rate, reduce your risk of stroke, manage your weight, reduce your risk of other diseases. Vasovagal maneuvers. When you find your heart racing, certain physical actions can work on your vagus nerve, the nerve that helps control your heart rate, to help bring down your heart rate. You should only try them if you have talked to your doctor about it first. Vagal maneuvers work by engaging your body's automatic reflexes. Types you can try for AFib include: pop your ears, close your nose, and try to blow and create pressure in your chest. This Valsalva technique can be very effective. Next, other ways to try are coughing hard and straining your stomach will also help. Carotid sinus massage. It's best to get your doctor to show you how to do this and to see if it is okay to try on your own. But here is the basic idea. First, lie on your back and turn your head to one side. Use your fingers to push on your carotid sinus, the blood vessel where you feel your pulse on the side of your neck, 5 to 10 times. Bear down. Another way to perform the Valsalva maneuver is to bear down as if you are using a toilet. When you clench your stomach muscles, it applies pressure to your chest and slows down your heart. Chill out. Your vagus nerve reacts to cold water. Fill a bowl with ice water. Try splashing your face with it or holding your breath while you dunk your head into it. Deep breathing exercise, along with moves that work on your vagus nerve, you can also use relaxation techniques to lower stress levels and calm your heart rate. To regulate breathing, get in a comfortable position, place a hand on your chest and belly, take deep, slow breaths into your belly, that is, let your belly expand without moving your chest. These are simple actions that can quickly slow a very fast rate into 100 beats a minute. Tips for living with atrial fibrillation. Don't ignore the warning signs. For some people, the irregular heartbeat of atrial fibrillation never causes a problem. For others, it can lead to strokes and heart attacks or heart failure. Symptoms of AFib may induce dizziness, fatigue, weakness, shortness of breath, and chest pain, especially when you have heart disease. People who have AFib are about 5 times more likely to have a stroke. Diabetes and high blood pressures raise that risk even more. Eat a heart-healthy diet. At least half your plate should come from plants such as leafy greens and colorful veggies and fruits. Add heart-healthy items like the omega-3 fatty acids in salmon. Good sources of protein include lean meats and legumes. Choose whole grain instead of refined carbohydrates for their fiber. A diet low in refined sugars, trans fats, and sodium helps control your blood sugar, cholesterol, and blood pressure, thereby lowering a risk of AFib complications. AFib and anxiety both have similar symptoms, but there is a difference. Anxiety causes constant worry and fear, sometimes to the point of panic. When you're having anxiety, one common symptom is a racing heart. You may wonder whether it is anxiety or your atrial fibrillation and if the two may be linked. Some research shows having anxiety does not raise your risk for AFib, but other studies show anxiety can trigger AFib episodes. Although results are mixed about a direct link, there does seem to be a connection between the two. High blood pressure, anxiety and AFib. Studies show that anxiety and high blood pressure show that although anxiety may not cause high blood pressure, it is common to have both at the same time. High blood pressure over time can increase your chances of an AFib episode. Anxiety and depression are more common with AFib. A study on older adults showed that both depression and anxiety were more common in those with AFib. For those who had both, their AFib symptoms were worse compared to people with AFib who only had one or neither of these other conditions. When to see a doctor? Although both anxiety attacks and AFib episodes can often pass off on their own without intervention, get checked out if your fluttering heartbeat lasts a long time or you have chest pain, breathing issues, dizziness, or confusion along with them. I hope you enjoyed this video. If you have not already subscribed, please press the subscribe button and click the bell icon and the like button so that all my future videos will be sent to you directly. Thank you. Bye-bye.